Is this normal? It's probably nothing serious. Maybe I'll feel better tomorrow.
Emergency symptoms can be good at hiding. That's why you shouldn't ignore symptoms like chest pain, high fever, trouble breathing, or severe stomach pain. They could be a medical emergency in disguise. Thankfully, an Eastside ER is ready to serve you 24/7 with fast wait times and dedicated ER experts, so we can quickly help turn your questions into answers. Visit eastsidemedical.com.
Broadcasting live from the Subaru of Gwinnett studio inside the Sonesta Gwinnett Place Atlanta Hotel. It's time for Gwinnett Business Radio. Gwinnett Business Radio is cared for by Eastside Medical Center, providing quality care to Gwinnett County and the greater Atlanta area for over 38 years.
And hello again, everybody, and welcome to Gwinnett Business Radio X. We're broadcasting from the Business Radio X studio, the Subaru of Gwinnett studio, here at the beautiful Sonesta Gwinnett Place Atlanta Hotel. I'm Mike Salmon, and on this special edition of Gwinnett Business Radio, we are, of course, going to be focusing on Eastside Medical Center, our newest partner, and today we're going to focus on Eastside's Bariatric Surgery program. And joining us on the panel today is Dr. Aliu Sanni. He's the Medical Director of Bariatric Surgery, and Tracy Kuzava, she is the Bariatric Coordinator. Did I say that all right, guys?
You were close.
I was close?
Yeah.
Close. How do you say your last name, Tracy?
Kuzava.
Kuzava.
Yes.
There we go.
Yeah, mine was correct.
And yours was, I was 1 for 2, 50%. Before we get to you guys, I want to let you know that our other partner, of course, is Subaru of Gwinnett, and love is what makes a Subaru. Get big savings and enjoy their hassle-free experience at Subaru of Gwinnett, where people sell cars. Visit SubaruofGwinnett.com and join their family today. Come on in and see the difference. If you're already a Subaruist, like I am, then follow Subaru of Gwinnett on their Facebook page and get the latest offers, news, and community events. Well, Dr. Sanni and Tracy, thank you for joining us. And we're going to talk about Eastside's Bariatric Surgery program. Give us a broad overview of the bariatric program that we'll find at Eastside Medical Center.
Eastside offers a nationally accredited surgical weight loss program that meets the highest standards for patient safety and quality care. As a bariatric center of excellence, which is a comprehensive center of excellence, our program offers, weight loss programs with the highest quality of care compared to national standards and the treatment of patients with obesity.
Okay, and we talk about the bariatric program. One thing that people might talk about is surgeries and procedures. Talk about some of the procedures and things that you offer.
Yeah, I think the first thing we try to identify when we see patients is, do they qualify for surgery? What are the qualifications for surgery? And so we always talk about the BMI, it's the body mass index. It's a calculation that looks at the weight, the ratio of your weight to your height. And it gives us a number that is generic to everybody. The normal BMI, which is the body mass index, is between 20 and 25. If you have a BMI greater than 30, that means you have obesity. The different classes of obesity. We have class 1, class 2, and class 3. And I'll try to, explain this as much as possible. Class 1 obesity is between a BMI of 30 to 35. Class 2 obesity is between 35 to 40. And then class 3 is greater than 40. The patients that do qualify for surgeries are patients of class 2 and above, which means your BMI has to be at least 35 and above for you to qualify for surgery. So that's how we qualify patients when they walk through the door to determine whether they do actually qualify for surgery or not. If they do qualify for surgery, the two to three major surgical procedures that we do offer. One of them is called the sleeve gastrectomy, which is the banana surgery. A lot of people know it as that, in which we make the stomach into the shape of a banana. What we're trying to do is to reduce the capacity of the stomach from like a 20-ounce stomach to a 5-ounce stomach. And how that works is it reduces the amount of food you need to eat before you get full. Also, the area of the stomach that we take out is where the hunger hormone in the body, the hormone that makes you feel you want to eat more, is located more on that side. So taking that side out actually reduces your hunger. And so that's how people lose weight through that procedure. The second major procedure that we talk about is what we call the gastric bypass. Mm-hmm. And what that means is that we are bypassing the part of the stomach with the surgery. So effectively, we are making a small stomach out of the big stomach. But in addition, that small stomach is connected straight to your bowel. your intestine. And so the big part of the stomach is actually bypassed. That's where the name comes from. And bypassing that area of your stomach, you're not absorbing too much that makes you gain weight. And in such a way, you lose weight.
Okay. For those that are heavy, of course, they could come in and I'm sure a lot of people may not understand is the BMI index or so forth. Yeah. They may go, okay, I'm just 30 pounds or 100 pounds overweight or whatever. Some may say, I just got a bunch of loose skin here on my arm or there, and I just want that kind of cleaned up a little bit.
Yeah.
You have procedures for that?
Yes, we do offer weight loss surgery. It's very different from cosmetic surgery. So a lot of what we deal with is actually people that are health-wise overweight.
Okay.
And so when we do the surgery, they will lose the weight. And in our major point of contact is to make sure that their health status gets better. So we're talking about hypertension, diabetes. So that's basically what we're focusing on, the health of the patient by losing weight. If they do develop extra skin, which is what you were alluding to earlier on, after the surgery, usually that's cosmetic surgery. It's a little bit different from bariatric surgery, but we can also take care of that.
Okay, but you really want to focus, as you say, on their health.
On their health.
For the cosmetic, maybe
later.
That's something later on. So you are the bariatric, the medical director for the bariatric surgery, and the surgeon, Dr. Sanni. But Tracy, as the bariatric coordinator, what is your role in all of this?
Yes, so I keep our program accredited. I also am the liaison between the doctor's office and the hospital. I'm also the dietitian for the program, and that's a huge part of the program is the nutrition component. So these patients, I often kid with them that they'll see more of me than they ever want to. So they see me when they come in for their first nutrition appointment, and typically insurance requires about 3 months. Some insurance requires 6 months. And so I work with them once a month with that. And then once they go to surgery, the hard part really starts. And then they see me 2 weeks, 6 weeks, 3 months, 6 months, 9 months, and 12 months after surgery.
So this is not where I come in, I get it done, and I never see you again. There's a whole process here.
Absolutely. The follow-up is critical to the success of their bariatric surgery.
You mentioned, Dr. Sanni, the ideal candidate, and you're talking about the BMI. Do you find people more male, female, age-wise? Kind of who are the ones that you see the most?
Well, I would say even looking at the national data, right? 70% of our patients are women, and usually you would see patients between the age of 45 and 65. So that's and that's in concurrent with what we see generally in the United States. So that's basically where we tend to they tend to fall into.
I would add to that is that we're seeing a lot more of the 20-somethings exploring it. We're seeing children that have high blood pressure and diabetes, and so they are exploring this surgery as an option at an earlier age, which is really great because it gives them lifelong weight loss and a healthier lifestyle, more active lifestyle.
That's all part of the bigger picture, too, is it not, Tracy, with the obesity of our country and
Absolutely.
The fast food and all that stuff?
Exactly.
Correct. We take the aspect of living to eat away, and you're just basically eating to live.
Maybe.
What is the ideal outcome that you want to see for all your patients?
So I think one of the things we look at is the percentage that they lose over a period of time. And it's difficult because everyone is different, right? But what we see on an average is most people will lose between 65 to 130 pounds at the end of the first year. So that's kind of a yardstick that we use, and you can follow that through from month to month in terms of what you expect them to do. And most of the patients following, I would just add this before I go on. I think the nutritional aspect is the most important part of the whole program. And I make this very clear to the patients that, we do surgery to help, but what's going to maintain the weight is the nutritional status. You're following what you're supposed to do even after surgery, before and after surgery. So we tend to see a lot of people lose between 65 to 130 pounds, like I said earlier on. Most people will fall in between. And if you look at the numbers when we're talking about the BMI earlier on, the reason you need to lose that much weight is to bring you back to where you're supposed to be.
You don't want to see them leave and fall into bad habits again, because you don't want to really see them again years from now and have to have another surgery.
Yeah.
Correct. I would add to that, too. When I see them in 2 weeks, I want them to have less foot pain, less back pain. I want them to be able to bend over and tie their shoe. These are little things, non-weight victories that these patients get to experience that are really great. Also, coming off the medications that they're on.
That's
That's
a
a
huge
huge one too.
Wow, that's amazing. We've kind of hit the highlights of the program and some of the procedures. Is this common at most hospitals, or is this something that sets you guys a little bit apart from maybe some others out there?
I think we have some competition in the Atlanta area, but what sets us apart is, I hate to say myself, but it is, I give them my cell phone number. These patients have access to me 24 hours a day, 7 days a week. So I get the text, can I eat this? I feel this pain, is this okay? And, if it's something that I can't handle, I definitely am texting Dr. Sanni right away to ask him to make sure we don't need to do something about it with this patient. And I think that really sets us apart, and the patients love that because there's so many questions that they have after surgery that they forgot to answer, forgot to ask, or maybe we forgot to, just educate them on right in that moment. So it makes them feel at ease when they can text me and I can immediately respond, and say, you're going to be fine. It's okay.
You asked about some of the questions, Tracy, they may ask. When it comes to these types of surgeries and procedures, some people may go, oh, they're no big deal. But to me, any surgery is a big deal. This is not something that people should take lightly. Oh, no big deal. I've gained another 50 pounds, 100 pounds. I'll just go in and have Dr. Sanni take care of me.
Yeah.
Correct. That is so true. I think some people think it's the easy way out. Some patients maybe even included, but once they have the surgery and they realize that it is some hard work psychologically, physically, mentally, it's all part of the program, and they realize, oh, this wasn't the easy way out.
And one of the things I think, I'm going to say two things I think really set us apart from, our competitors around here and most programs that I've been to. The fact that we have that personal relationship with the patient. A lot of the patients go to the other programs and they don't see the surgeon until the day of surgery. I see them at every visit. And they do like that, the fact that they know who the surgeon is or what the plan is. And also, I think at our program, we mandate the patients to change their habits before surgery in terms of making sure they understand the nutrition that they need to follow. If they don't, then what are you doing the surgery for? Because they're just going to keep on doing. Nothing changes overnight. It's a process. So we ensure, which Tracy does very well, and a lot of them will come back and complain and say, well, Tracy is kind of hard. I say, yeah, because you need to do the right thing. We're not doing it for our sake, because after surgery, eventually you're going to be on your own. You have to be able to make the right choices. What brought you here is because we made the wrong choices. Now we have to correct that if we want to stay on track, losing this weight and maintaining the weight.
And it's good to have a surgeon that has a great track record with very low complications.
Yeah.
Well, I was going to ask you not so much about the track record, but your background, because I'm sure one of the questions that a lot of folks will ask, well, how long, Dr. Sanni, have you been doing this? And what is your success rate and things like that?
Well, I graduated from med school in 2000, so I've been as a doctor for 19 years. I trained initially, I did my med school in Nigeria, but I trained mostly in England for about 10 years, and then I moved over to the United States. So I've been doing this for a while. At Eastside Medical Center, we've had very good success because we take our time. When it comes to doing the surgery, a lot of attention is paid to everything. We do this surgery robotically, laparoscopic, which is minimal incision, which means less pain, quicker recovery, and less chances of wound infection. And it makes a huge difference when you see the patients the day after or 2 weeks after. And so with all those being put together and also having a very good program, having Tracy, I couldn't do any of this without Tracy, to be honest with you. She's great. The patients love her. They listen to her. And so having that, with me has just made the program a success in terms of our outcomes.
Yeah. Well, and you can have all the latest technology and robotic surgery, but it's still a very personal experience, which is where, you're doing the hard work, but boy, Tracy's probably the MVP in some cases.
Thank you.
You touched upon robotic.
Yeah.
Talk about some of the latest technology in the robotic surgery technology that is at your fingertips.
Yeah, well, I've been doing robotics for about 10 years now, and when we started off, we had, the SI system. Now we've actually purchased the XI at Eastside Medical Center, which is the latest, robot in town. The reason why that's really a game changer is it makes things very, very different. Very complicated cases seem less complicated. The visualization on the new robot is so much that you can see every fiber of what you're operating on. And if you're doing dangerous procedures, it's important that you see everything. So, and then the fact that you can sit down, you don't have to stand for 6 hours doing surgery, it's a big difference. I was doing a case yesterday that was a very difficult case that would have taken me 6 hours. Took me out 2.5 hours. And that's because of the help of of what we have. And as we were saying earlier on, I do all my bariatric, cases are done robotically. Mm-hmm. All my general surgery cases, which includes hernias, gallbladders, appendix, colons, I do everything robotically. And you can tell, especially if you've done this other ways before, because I've done them other ways before, when you see those patients and you compare the outcomes on both ends, you can clearly see there's a big difference. And robotics is the way of the of this future. Nobody, regardless of what people say, when you see your patients come back and they don't have any pain, or they can go back to work within 3 days, then you got to change and do the right thing. And I think that's the way forward. And that's been our own experience in using robotics in general surgery, foregut surgery, colorectal surgery, and bariatric surgery.
And just to be clear, you're still the surgeon. The robot's not doing the surgery, but it's still you.
Yes. So the concept behind robots, people think the robot is doing the surgery. What the robot is it's a platform to assist you when you're doing surgery. And majorly, it's actually in terms of visualization, 3D image. If you go to the movies and you watch something on 2D and you watch it on 3D, it's a big difference.
Yeah.
And that's very important when you're talking about operating on a live person. It makes a huge difference. So the robot is just a platform. I am the one controlling everything that's done. The robot is not doing anything by itself.
I'm sure it's been amazing, just the changes you've seen in the time that you've been a surgeon.
Exactly.
I understand, too, that there's a weight loss seminar that you guys offer as well. Tell us some details about that.
There is. Once a month, we do a weight loss seminar where anybody who's interested or think they may be interested in learning about the surgery or having the surgery can come. And we talk about a little bit of the history of obesity and why we're leaning more towards bariatric surgery, and then the different types of surgery that we offer. So it's a very informative session that anybody can come and join.
And where can people find out information about that?
If they go to eastsidemedical.com and look under services and weight loss surgery, they'll find a link where they can register for a seminar.
Okay.
And it's free.
And it's free?
Yes, it is free.
Okay, great. As we focus on Eastside's bariatric surgery program, it's obviously top-notch, great. You got the technology, the medical center facilities are unbelievable. But I think we're all in agreement that the whole idea is we want people to be healthy, first of all. Hopefully they're eating right and exercising first. And this might be a last, maybe not a last resort, but or would it be a last resort? We prefer they not have to have the surgery, right?
Yeah. Insurance likes it to be the last resort, and in many times it is. Since it is a surgery, it should be the last resort.
Okay, wonderful. What's next with the robotic and the technology? Any ideas, Dr. Sanni, as we look 10 years from now, what it might look like when you're doing these surgeries? You talked about how the time is saved right now and what you see, but any idea?
I think people underplay the effect of research in life generally, and I think there's a lot of research going on. Obviously, we started off doing this open, and then we move on to laparoscopic surgery, and now we're talking about robotic surgery. So I think one of the new things that people are talking or we're looking into now is endoscopic surgery. But that's something of the future. Endoscopic surgery means there are no incisions. You're doing this from the inside. But that's still pretty new. Still investigatory at this point. But I think that's one of the things that we're looking at. Also, medically, a lot of patients, like Tracy was alluding to earlier on, trying to treat these patients when they're younger, when they have a risk of obesity, actually prevent a lot of this in the future. And I think we're moving towards preventive rather than curative medicine, which I think is the most important thing. Trying to prevent obesity rather than trying to treat it at the back end. I think that's the most important thing.
Okay. We talked about what this looks like for the patient from the beginning to the end. Let's go back to the beginning a little bit. If someone thinks they may need it or not 100% sure, consultation with you guys first, how does that work?
Typically, we say come on down to the seminar first so you can learn about your options, but a consultation is always an option too. If maybe you don't want to be in a group and learn about it, you can always call Dr. Sanni's office and get a consultation with him.
Great. And as we get ready to close the interview, any other words or parting words as far as what you want people to take away from this as we talk about your bariatric surgery program?
Well, I would say that up to about 40% of Americans obese, and that's increasing.
40%.
Yeah, 40%. And that's increasing in numbers on a daily basis. And so having a comprehensive center of excellence for the management of weight loss, because we just don't do surgery, we manage every form of weight loss. I think it's very reassuring, and our results that we've had over the last few years or over the years has been high quality, top notch. I train at Emory University Hospital, and I took my training from there to come down to Eastside, and we've been able to replicate what's been done at the big tertiary centers. If you think about patients that live in Gwinnett, would they want to drive all the way to Emory when they can get the same thing just down the road? And so that's why we're here, and I think our quality speaks for us, and also our results over the years has been fantastic.
I don't think people realize the level of care that's available right here in Rome backyard.
Exactly.
Absolutely.
And then Tracy, your role, I didn't know there was a person like you that makes that's got to make the patient feel so much better.
It really does. I know most patients say, I didn't realize I was going to gain a family member with this, and they do. And I feel like they all, or maybe all my children at first, and then they become, other family sisters and aunts and that kind of thing. But long after that first year too, they do keep in touch, and randomly I'll text them if they haven't kept in touch just to see how they're doing. And most of them say they hear my voice in the back of their head when they go to the refrigerator or the pantry. Don't do that. So it's a lifelong commitment and a lifelong friendship that I build.
Well, you're doing your job well if they're
Thank
hearing
you.
your voice
That's
in the
right.
middle of the night.
That's what I say.
For those that would like to read up a little bit more, you mentioned the seminars, the free seminars. Where can they read up on more information?
They can actually go to eastsidemedical.com, look under services and weight loss surgery, and they'll find some frequently asked questions under there, as well as my phone number if they want to call me, Dr. Sanni's phone number if they want to call him, and again, that link to the free seminar that they can attend.
Great. Dr. Sanni and Tracy, thank you so much for joining us.
Thank you.
And congratulations as we talk about Eastside's bariatric surgery program here on Gwinnett Business Radio. And as we close the show, I want to let you know about quality care, and it's close to home. It's Eastside Medical Center, and they've been a community healthcare leader for over 39 years. And you heard a few stories today why they are a leader. Nationally recognized for patient safety, Eastside focuses on delivering quality care with exceptional outcomes by utilizing the most advanced technology and experienced physicians. For more information on Eastside's system of care, visit eastsidemedical.com. Again, a thank you to our guests, a thank you to our listeners, and also to our producer, Trey. A reminder, you can listen to this program anytime, 24/7, by going to businessradiox.com, select the Gwinnett studio, and then click on Gwinnett Business Radio. Until next time, I'm Mike Salmon, and this has been Gwinnett Business Radio on Business Radio X.